So our next speaker is Dr. John Cush, Director of Clinical Rheumatology at Baylor Research Institute and Professor of Medicine and Rheumatology at Baylor University Medical School. He was a fellow in Texas with Morris Ziff. He's been in Super Doctors. He's written textbooks. He's executive editor of RheumNow.com and also Rheumnology, which is a free online textbook. And he's going to talk about preventing infections in patients on biologics.
Well, again, thank you very much for the opportunity to be at this great Congress. It really is an honor to come to such a good meeting on a frequent basis because, again, the people here are sort of like a family, and the education is of the sort of highest quality. I mean, your list of speakers is astounding. My only regret is I didn't get here early enough to give Ed Keystone a hard time. But I hope that you did that in my absence. So I'm going to talk to you about managing and preventing infections in patients who receive biologics. This is my disclosure wherein you should note that I do consult for and do clinical trials on the products I'm about to discuss. Hence, that could be a conflict of interest, and it's up to you to decide whether I am or am not. Please let me know if you think I could be more balanced. So, 55-year-old white female with severe rheumatoid arthritis. She's taking methotrexate, leflunomide, and a TNF inhibitor, and then dies of a pneumococcal pneumonia. Just get cut right to the chase. You're filling out the death certificate. The cause of her death was 1, hypogammaglobulinemia, number 2, a complement deficiency, 3, rheumatoid arthritis, 4, biologic therapy, 5, steroids. Answer now with your keypads. Oh wait, we don't have those. So, you know what the resident's going to write. This patient was profoundly immunosuppressed by the drugs that she was taking. And there certainly is a role for that we'll discuss in the next hour. But you should know that really the best predictor, the factor that tends to be most important in an infectious-related death is the severity of the disease itself. I can tell you I have plenty of patients who fit this story and who had horrible outcomes, and you want to blame the steroid, you want to blame the new biologic, you want to blame, that they were once on cyclosporin or something ugly, but the fact is this person's got a lifelong history of severe, debilitating, inflammatory disease that really has ultimately contributed to immune dysregulation to the point that they can't handle normal infections. So RA is the cause of death. Then at some point, the drugs do play a role, and you'll see where that comes in later. Steroids are most important. Steroids, almost every study, almost any disease, almost any dose. There is probably a dose at which steroids don't contribute to infectious risk when you start getting it down to 1 to 5, but probably not 7. So again, you can find different bits of evidence from different studies, but I would just tell you steroids, almost at any dose, are a major risk factor. Comorbidities, heart failure, renal failure, diabetes, but don't discount or don't overlook the importance of chronic lung disease. All chronic lung disease, ILD, COPD, BOOP, bronchiectasis, these are the major things that hurt our patients with rheumatoid arthritis. The number 1 cause of infectious death in rheumatoid arthritis is pneumonia. The number 1 contributor to pneumonia is chronic lung disease, okay? Breakdown of skin by doing surgery or having ulcers and whatnot that are open is another risk factor. So note that DMARDs themselves are not a risk factor. And that realistically, if you're getting down to evidence that's in a court of law, TNF inhibitors are not a risk factor independently by themselves. All right, and I'll show you some of that data. Now, you combine it with a bunch of other factors, and then it does seem to be an additive risk. So we have a large number of biologics that we're playing with now in the rheumatology space. These are made major changes in maybe how we manage our diseases, but when you're concerned about the safety of these drugs, the one unifying concept is that of infection and serious infectious events, or SIEs. This is a constant struggle that we will have to deal with, and understanding what we're dealing with and how to prevent infections is most important. So, we're in the business